My name's Jim Bolton. I'm consultant with a psychiatry team based in a general hospital. And a common reason for referral to my service is a patient with medically unexplained symptoms. I'm going to discuss this topic, which gets relatively little time in the medical curriculum, but takes up an awful lot of time of practicing doctors. I'm going to discuss what medically unexplained symptoms are, think about how common they are, discuss what causes them, because if we can understand what causes them, we're in a better position to know what we can do about them. The learning objectives from the curriculum that this talk will cover include the concept of medically unexplained symptoms generally, but also briefly describing the key clinical features of three disorders: somatoform, hypochondriacal and dissociative disorders, and thirdly outlining the management of a patient with medically unexplained symptoms. A large part of what doctors do is discussing signs and symptoms with a patient, eliciting these through history taking and examination, undertaking appropriate investigations, and all of this helps to identify the underlying pathology. This enables us to reach a diagnosis for a patient and thereby to determine what management they require. But quite often, a patient's apparently bodily symptoms are unexplained by physical pathology. Some people are surprised to hear that in primary care this will be up to 1 in 5 referrals. And in outpatient clinics in a general hospital, the proportion of patients presenting with medically unexplained symptoms, symptoms not explained adequately by underlying organic disease, will be something in the range of 1/4 to 1/2. It's as many as 1/2 in certain specialties like neurology, gastroenterology and cardiology. So as you can see, it takes up a lot of time of practicing doctors. This list comes from research in general practice and gives some of the symptoms that most commonly patients present with that remain medically unexplained, starting with muscle and joint pain, low back pain. If you look down the list, these are often common human experiences. I, for example, will have experienced most of these in the last couple of weeks. What's different between me and a patient, though, is that I haven't chosen to present these problems to a health professional, and that begins to give us a little bit of a clue about what might be going on.